For centuries, societies have grappled with the use and regulation of drugs in the United States. Drug policy has a complex history marked by periods of prohibition and significant investments with often limited success. Understanding where we've been and the current state of affairs sets the stage for examining public opinions on alternative approaches. This was done with a set of 11 questions covering demographics, perception of drug use, primary goals of drug policies, funding priorities, and more. As you can see, the age distribution was primarily younger adults and those in the 45 to 54 age range. The majority of respondents identified as female and a significant portion identified as Hispanic/Latino, which is an important demographic consideration, especially for those of us in Texas. The educational background of respondents varied with a good representation from those with some college and bachelor's degrees. It's also important to note that the vast majority of respondents currently reside in Texas, which might influence their perspectives on state-level drug policies. One of the fundamental questions I asked was whether drug use is seen as a crime or a public health concern. Interestingly, the large group felt that it was both equally, suggesting a nuanced understanding of the issue. However, a substantial portion viewed it as primarily a public health issue, indicating a desire for more treatment and support-oriented approaches rather than solely punitive measures. The small percentage viewing it solely as a criminal issue highlights a divergence in fundamental beliefs about how to address drug use. I also explored what people believe should be the primary goal of drug policy versus what they perceive the current goal to be. Ideally, harm reduction, minimizing the negative consequences of drug use was seen as the most important goal. Prevention and treatment also ranked highly. However, there's a stark contrast with the perception of current policy where an overwhelming majority believe the primary goal is punishment. This gap between ideal and the perceived reality is a critical point to consider. This question delves into where people believe resources should be allocated. The strong agreement that increased funding for treatment would be more effective than increased funding for law enforcement in tackling drug-related problems aligns with the view that drug use is largely a public health issue. This suggests a public appetite for investing in solutions that address the root cause and consequences of drug use through support and rehabilitation rather than solely through policing and incarceration. Here, I presented several statements related to drug policy and asked respondents to indicate their level of agreement. The significant agreement that drug prohibition leads to increased crime rates supports the argument for exploring alternatives to prohibition. The more divided opinion on whether drug legalization leads to increased drug use shows a level of uncertainty or perhaps a belief that regulation could mitigate increased use. The overwhelming agreement that current drug policies disproportionately harm marginalized communities underscores a major concern about social justice and equity within the current system. The majority belief that legalization of drugs would improve public health outcomes suggests that an understanding of the potential for regulation to ensure safer products and access to health services. Understanding where people get their information is crucial for effective communication and education around drug policy. The prominence of news and social media as primary sources highlights the need for accurate and responsible reporting on these platforms. The reliance on academic and government sources by some indicate a desire for more in-depth and official information. Personal experience also plays a role in shaping opinions, emphasizing the human impact of drug policy. This survey provides valuable insight into how a segment of the public perceives drug policy. Key takeaways include a desire for a shift towards harm reduction and treatment, a strong awareness of the disproportionate impact on marginalized communities, and a cautious openness to exploring legalization as a potential solution. These perceptions are vital for informing future policy discussions and ensuring that any changes reflect the needs and values of the community. Your understanding of these issues is the first step towards meaningful change. I encourage you to delve deeper into drug policies specific to our area here in Texas, encouraging your elected officials and participating in the democratic process through voting are powerful ways to influence policy decisions. By staying informed and getting involved, you can contribute to shaping drug policies that are more effective, equitable, and focus on public health and well-being. Thank you.